Doctor, what is fresh and frozen embryo transfer?
During an in vitro fertilization cycle, an embryo can be transferred either fresh or frozen. A fresh embryo transfer is a medical condition in which a recently created fertilized embryo is transferred into the uterus. That means the transfer happens in the same cycle. A frozen embryo transfer is a procedure in which a previously frozen embryo is cryopreserved, thawed, and transferred back into the uterus. Fresh embryo transfers are typically done when embryos are at the blastocyst stage or at the compacted stage, and this blastocyst stage or compacted embryos have high potential to implant, and generally one or two embryos are transferred. The embryos that are transferred in the uterus using a thin flexible tube called the embryo transfer catheter, in which these embryos are loaded and then threaded into the cervix, into the womb where they are deposited. Frozen embryo transfers are typically done when an individual has previously undergone an IVF cycle and has cryopreserved, also known as frozen, the embryos that are available in that cycle, and these frozen embryos are thawed, also known as raising the temperature from -197 to room temperature, and transferred into the uterus in a similar manner to the fresh embryo transfer. The success rate of fresh and frozen embryo transfers can vary depending on a variety of factors, which include your age, your health, your partner's age, quality of embryos, the ease of the embryo transfer, and the quality metrics or the KPIs of the clinic. It's important to discuss how many embryos to transfer at the frozen so that you are minimizing the multiple pregnancy rates. So the fresh and frozen embryo transfers can be divided into two groups. One group where it's routine practice to transfer fresh embryos and preserve the extra embryos for future use. The second group is freeze-all protocol, where no fresh embryo transfer is done and all the embryos are frozen, and then those embryos are transferred at a later point depending on the mutual convenience of the clinician and the couple. So fresh and frozen embryos context has changed. So the current context is fresh embryo transfer is using embryos in the same cycle and freezing the extra embryos. Freeze-all protocol is not doing a fresh embryo transfer but only using frozen transfer. And frozen transfer can also mean the extra embryos that are remained after doing a fresh cycle. So these are the words one should remember: a fresh embryo transfer followed by a frozen embryo transfer, a freeze-all protocol followed by a frozen thawed embryo cycle, and last but not the least is having a live birth and a stored embryo which is frozen in the liquid nitrogen, where you thaw it and get it transferred, is other group. One should have clarity about these when they decide on any of these procedures.